5 ways to effectively manage gestational diabetes. 5 ways to effectively manage gestational diabetes. Gestational diabetes is a very common condition that occurs in pregnant women who don't already have diabetes. It most often occurs in the 6th or 7th month of pregnancy, but the good news is that it usually resolves after pregnancy. Certain factors increase the risk of developing gestational diabetes. Having a high body mass index or age greater than 35 increases the risk of this condition. Having a history of a previous baby with a high birth weight, over 9 pounds, correlates highly with gestational diabetes. Asian, Hispanic, Native American, and African American ethnicities, as well as family history of type 2 diabetes, are significant risk factors for developing gestational diabetes. Complications of gestational diabetes include urinary tract infections, intermittent low blood sugar levels, macrosomia, large birth weight baby, and preeclampsia, high blood pressure, and associated damage to organs like the liver and kidneys. The best way to keep these complications from occurring is to control blood sugar levels intensely. The following are 5 ways to guide your control of this condition and prevent it from escalating to serious consequences. 1. Watch your diet. Just like any form of diabetes or disease process, your diet is of paramount importance. It's a great idea to ask a nutritionist to structure a meal plan that is conducive to your condition. The goal here is to keep your blood sugar levels stable. You'll need to consume your macronutrients in the right amounts and right combinations. While you may have lots of food cravings when you're pregnant, it's best if you know the times when it is safe to indulge and when to be disciplined in your diet. 1. Stay active. Pregnancy is not an excuse to lead a sedentary lifestyle. While you may wish to avoid high-impact activities, such as running or kickboxing, you should still try to get some daily exercise. Walking is really a healthy and wonderful exercise. If your back aches, you can try swimming, which is easier on the body. Choose an activity that is suitable for you. It could be anything from spinning on the stationary bike to hiking, or even Tai Chi. What matters is that you move in some activity in your life. 1. Consult your doctor. It goes without saying that you should see a doctor to determine the nature of your condition. If your blood sugars are running at a higher average, then it will be important to have closer supervision and monitoring. In most cases, close attention to your diet alone is all that will be needed to improve your control. However, if blood sugar levels don't improve or if they worsen, your doctor may prescribe insulin or other medication to treat you. 1. Monitor your blood glucose levels. What gets measured gets managed. The best way to keep your diabetes in check is to monitor your blood glucose levels. One of the most common problems is forgetting to check your blood sugar. The best practice is to put this at a high priority and check your blood sugar at least once a day for the best outcomes. 1. Watch out for increased thirst or increased urination. The symptoms of increased need to drink fluids and urgency to urinate frequently are key signs for elevated blood sugar. If you experience these symptoms, be sure to check your blood glucose quickly. Getting it under control before it gets too high is key to the best outcome. Gestational diabetes is something that can be efficiently managed with careful monitoring. So, give it the attention it needs and always err on the side of caution. Follow the tips above and watch your diet closely. If you can do that, it's half the battle won. We hope this helps you. Ellen and Michael Moriarty, 2 RNs.